What's a sick day? No, so I would, apart from when I've been pregnant, I've always managed to control things. I think it throws things completely out of balance when I've been pregnant, and I think that's where it becomes difficult to understand how best to control it. With me, I think it is just literally making sure you are checking your blood glucose levels as often as you can, your fingers can take it. And just sort of monitoring what things are doing and how much fluids you're taking in.
When you're unwell, your blood sugars actually go higher, and if you are active. So normally we would expect people to try and be as active as possible, but during periods of illness or hyperglycemia, we would be looking for patients to actually rest as much as possible, and this will encourage the blood sugars to come down.
Illnesses likely to have an effect on blood glucose levels are a cold, flu or a virus, stomach upsets, sore throats, urinary infections, chest infections, abscesses, an injury such as a broken bone, and being treated for an illness with steroids.
Hyperglycemia is essentially blood glucose levels or blood sugar levels in the body which are too high.
Why does it occur? It occurs for a variety of different reasons. The most common cause of high blood sugars are you're not on enough insulin, or not enough, the dose of tablets is incorrect. It could be that there's a mismatch between what people eat and what people do and the medication that they take. It could be being ill. It could be any number of different things that cause high blood glucose levels.
Some of the signs and symptoms of hyperglycemia: they may feel a bit more tired than usual. They may suddenly feel that their eyes are a bit blurred, and they may also feel that they get a headache.
If they have high blood glucose levels, they can be thirsty quite a lot. The reason they're thirsty is because they're peeing quite a lot, and the reason they pee quite a lot is because they're losing lots of glucose in their urine. It's just the way the kidney can't handle the amount of glucose that's going through, and you have to pee out lots of glucose and lots of water. And that's, of course, why you also get thrush. Some people get thrush with high blood glucose levels, and because you're peeing into a warm, moist environment with lots of sugar and lots of bugs, which is an environment that the bugs love. So it's another one of the symptoms. And because people are peeing out calories in terms of glucose, people can often lose a bit of weight, especially if their blood glucose is quite high for a long time. So that's why the symptoms of diabetes are weight loss, feeling tired, drinking lots and peeing lots. So sick day rules in people who've got high blood sugars, or if they're unwell, so if you're sick. So that involves testing your blood glucose really very much more frequently, even up to every hour or 2 hours sometimes, depending on how ill you are.
Drink at least 100 ml of water or sugar-free fluid every hour. The aim is to drink 2.5 litres or 5 pints per day. Rest and avoid strenuous exercise, as this might increase your blood glucose levels further.
If you've got persistent hyperglycemia, then often, depending on the level, it's above 13 or so, often you're advised to check either your blood or your urine for what are called ketones, which are these other chemicals in the blood that can be quite harmful. And if you have ketone levels at a certain level, you're advised to either contact your healthcare professional or actually come into hospital, because you can be quite unwell with that.
If you are unwell, then it's important to never stop taking your diabetes medication.
So if you can eat normally, eat normally. If you can't, then as I've just said, that you need to make sure that you're drinking lots. You need to make sure, and if your blood sugars are reasonably okay, as long as it's sugar-free drinks or water, that's fine, but don't stop your insulin.
Here are some suggestions for meal replacements. Carbohydrates: 200 ml of milk, 1 small glass of fruit juice, 100 ml, Lucozade, 50 to 75 ml, non-diet Coca-Cola, 100 to 150 ml, lemonade, non-diet, 100 ml, ice cream, 1 scoop, 50 grams, jelly, normal, 2 tablespoons, 65 grams, yogurt, fruit, low calorie, 1 small carton, 120 grams, yogurt plain, 1 small carton, 120 grams.
If you're just on tablets, then you may not be measuring your blood sugars, because many people who are just on tablets are advised not to do so. So they won't necessarily know they've got a high blood sugar level. But if they are testing and they do have a high blood sugar level, then there are some sick day rules that they can follow. If you are on insulin, then you may have to take much more insulin. You may have to give yourself short-acting insulin far more frequently during the day, and the dose of that will depend on how much your overall dose of insulin is. You're advised to drink a lot more sugar-free fluid and water to try and maintain your hydration levels, which is really important. And if you can't eat and drink because you just have tummy upset or for whatever reason, then you need to be taking, you may need to take sugar-filled drinks. The important thing is you must never stop your insulin. That's quite important. If you're not eating and drinking, never stop your insulin. You may need to have other forms of carbohydrate in the forms of fluid, but never stop your insulin.
And if you're able to continually check your blood glucose level, at least if you see that it's more or less stable, or if it starts to rise, you know that your body's responding to the stress hormones. You know that you need to give yourself a small amount of insulin. And if you check it on an hourly basis, knowing whether your blood glucose levels are going up or down, and you can begin to understand what kind of level of insulin you need. So,
Steroids. Steroids are a group of drugs that are used to reduce inflammation and are used to treat conditions where inflammation occurs. If someone already has diabetes and they're prescribed steroids, they may notice a rise in blood glucose levels. This will probably mean their diabetes treatment may need adjusting or altering. It is advisable to contact their doctor or nurse for advice.
So they should be seeking healthcare advice, basically if they're not very well and they can't, for whatever reason, they can't follow the sick day rules, they can't remember the sick day rules, or if they are following sick day rules and things aren't getting better. So if they've got lots of ketones in their blood or their urine, their blood glucose levels remain high and they remain symptomatic, or if they're vomiting, eating, and they can't keep any food or liquid down, then they certainly need to contact their healthcare professional. If they're drowsy or confused, their friends or significant others need to be contacting somebody very swiftly, because that's not a good sign, and it's better to be safe than sorry. So call for help sooner rather than later.
I suppose most people don't like to plan things like this, but I know that there are always friends and family around who can help out with childcare, because the biggest issue for me is just making sure that the children feel happy and safe and know why I'm not there. But otherwise, I know roughly what to do for myself, and if I guess if I'm ill, my way of looking at it is, if I can't sort it out within 24 hours, I ring somebody if I'm not better or if things haven't changed.